So the first thing we want to talk about is, where is this lump? So that's why telephone conversations, even though, like telemedicine and stuff, we can do that to some extent. But say, for example, a mass on your dog's breast tissue, for example, that's a very popular one. So let's say a mass, a breast tumor or mass. That's a very common one. So let's talk about that. Where is the mass? So a mass on your dog's right side is going to be a little different from a mass on your dog's breast or mammary tissue, or a mass on the toe, or a mass above the eye. So where that mass is has a lot to do with, is directly related to how easy or difficult it is to test or to remove. What are some of the considerations for implications of the structure that's close by? For example, if it's by the eye, will it grow into the eye? So the first thing we want to talk about is where that mass is. So depending on where that mass is, gives us a very good idea of this, if this is something that's malignant or cancerous or benign. So we perform a couple of tests to try to figure out if something is malignant or benign. But for starters, one thing we look at is its location. Number two, how long has this mass been on your dog's, wherever, the mammary gland or the eye or the side of the chest? How long has this mass been there? Let's say you noticed it a year ago. Has it grown any? Is it basically the same size? What exactly does it look like now? So we usually use calipers to measure the size of the lump so that we can have an idea for our medical records what size that lump is. So if somebody else or the same vet is looking at the mass again a week from now, a month from now, is it getting any bigger? So we have one, we have where is this mass? Number two, how long has it been there and how fast has it grown? Number three, is it red? Does it look angry and inflamed? Is it wet or dry? All of these things help us to get an idea of whether this is something that's nefarious, whoa, that we need to pay attention to or do something about. So there's some masses that we can say, let's monitor, and there's some where like, okay, no, this needs to go to surgery right now, and that's just the way it is. So what is it? Where is it? How long has it been there? What does it look like? Is it bothering the pet? Is it the pet scratching at it? Is the pet able to bite at it? Those are things that give us an indication as to whether we should be paying extra special attention or we can do a monitor, wait and see approach. There are several. So the biggest question is, my God, doc, is it cancerous? So cancer, masses can be either cancerous, as in neoplastic, as the medical term, cancerous, malignant, which is what we understand, or benign. It's a lump, but it's not cancer. So should we or shouldn't we remove it? So that's one of the main questions that clients will ask. Is it cancerous? My God, does my dog have cancer? So the next step is, what are we actually going to do to figure out whether this mass is cancerous or not? Is it a problem or not? Is it going to grow and then invade other tissue? Like, what do I do about it? So in order for a doctor, a veterinarian, to figure out whether a mass is malignant or benign, there are two general tests that we like to perform. One of them, I want to say three, but it's like 1 and 2A and 2B. One of them, the most common in-hospital, in-clinic test, is called a fine needle aspirate, FNA for short. So here on out, I'm going to use the abbreviation FNA, fine needle aspirate. I'll put the actual words up there so we don't get too techie and medically. So fine needle aspirate. What this basically does, the name kind of gives you an idea of what we're doing here. So it's a fine needle, a small enough needle that it won't necessarily harm the pet or hurt the pet too much in that assessment. And then the needle, and then of course aspirate. When you aspirate, you're trying to pull something out of an area or a tissue. So fine needle aspirate is where you're using a sterile needle and syringe to try to get down into that mass to pull some kind of tissue, cellular contents, anything that can give you an idea of what is going on behind the skin, right? So there are some advantages and disadvantages of doing a fine needle aspirate. So number one, a fine needle aspirate is what I would call a snapshot in time. So imagine you have this mass and you're going to take a needle and you're going to stick, let me use this here. You're going to use a needle and you're going to stick inside of the mass. Now, you're assuming that wherever you're sticking that needle is going to be a good representation of the rest of the mass. Supposing the mass is a different makeup or consistency at the outside as opposed to on the inside. So when we're doing fine needle aspirates, we tend to go into the center and then we kind of move the needle around a little bit to see if we can get a good representation of the entire mass. So the advantage of this procedure, especially in hospital, is your dog does not need to go under anesthesia for that. Sometimes they might need a little bit of a woozy medication, but most of the times a dog will sit still because the needle is very fine. What we're doing in hospital, it's not as expensive as putting them under anesthesia to remove it. It's least invasive. It's something quick that you can do in the hospital, and they do not have to stay overnight if you have a hospital like that. So a fine needle aspirate is a good, cheaper, not cheap, but cheaper way for us to tell what exactly is going on behind the scenes, behind the skin of that mass. So you can say, okay, you send that, whatever you get, you put that on a slide, and then you send that to the lab, and the pathologist will review it, look under the microscope, do their thing, and then say, okay, this is what we have, this is the kind of tissue that it is, this is what we have. And that they usually will give you prognosis. They can say, okay, if they got a particular tissue, like it's a benign lipoma, for example, that's a very common thing that we find, fatty tissue, fatty masses underneath the skin that develop over time for whatever reason, fatty deposits. And you're like, whew, it's just a benign lipoma, which is a fatty mass. No problem. So you breathe a sigh of relief. So the advantages of FNA is that it's cheaper, it's least invasive, and it's something you can do in the hospital. What is the main disadvantage of a fine needle aspirate? I have found I don't perform too many fine needle aspirates, not because it's not a good test, but just because a lot of times my clients are, I don't want to say strapped for money, but everybody is budget friendly. So you want to make sure that you get as much bang for your buck as possible. So when I do a fine needle aspirate, I always tell the client, listen, this is a snapshot in time. There is no guarantee that we will have enough tissue or enough of a representative sample in wherever we've sampled that kind of comes back and tells you exactly what this mass is. So as a result of that, as long as the client understands that this result can come back as inconclusive, which means you've spent, I don't know, $200, $300, I don't know what everybody is charging, $200, $300 for a fine needle aspirate. And then if I come back and say, hey, we're going to discuss the results, and the results say that it's inconclusive, you're going to be not only disappointed, you're going to be frustrated. So you're out however much money it costs to do the fine needle aspirate, and your dog got the needle sticking into him, and then you don't have an answer. So as long as you understand prior to me doing that procedure that there is a limitation that it can come back as inconclusive, then I'm okay with performing the procedure. As long as you know that if we don't find out what it is, we can take it to the next step. And the next step is the one that I really do. I'm a surgeon at heart. So I say, okay, if it's not in a place that's a horrible place to stitch and whatever, like the elbow that doesn't have a lot of tissue, let's take it off, man. Take it off, straight to surgery. So of course, that's obviously more expensive to go to surgery. It's obviously more taxing on that animal's body, medical health status wise, because you have to go through all of the things with anesthesia, pre-anesthetic blood work. Then you have to take off this is why I was saying 2A and 2B. You have to take a piece of the mass or all of the mass and send it to the lab so that they can give you an idea of what it is. I generally just take, we call incisional for the first one, which is a piece of it, and excisional, which means I take the whole thing off and send it to the lab. I'm all for number 2B. I am the person who is going to opt for removing that mass from your dog. So I have that entire mass in my hands so that I can say, hey, pathologist, here is the mass. Please cut it into little pieces and tell me what it is. So again, let me recap. Fine needle aspirate, as well as excisional or incisional biopsies. I am going to do an excisional biopsy. I'm going to take the whole thing off and I'm going to send it to the lab. So let's recap a little bit in the middle of this video. So where is it? How long has it been there? What does it look like? How fast is it growing? And now the big question is, what the actual heck is this mass? And that's where the fine needle aspirate, the incisional biopsy, and the excisional biopsy, as you take the whole thing and send it off, that's where those things come in. Now, depending on what those results say, that is where we get into the nitty-gritties of what does the veterinarian, your veterinarian, remember, I'm a veterinarian, but I'm not your veterinarian, unless you want me to be. But that's now when you get the results, and you can now have an informed discussion with your veterinarian and say, the veterinarian is going to say, let's say in the case of a breast tumor, it's benign, and we could either watch it and see, but it's a lipoma, it's just a fatty mass, or my God, it's a cancerous malignant tumor of the breast that we need to take her into surgery as soon as possible. And I just want to reference one of my other videos. I'll try to put it up here, where we talked about spaying and neutering and the potential for your pet not developing mammary or breast tumors because you spayed them early in life. This is one of those things that we can prevent if we spay them before their first heat. I don't want to say prevent 100%, but the chances of them getting mammary tumors are slim to none if you spayed them before their first heat. Of course, remember that the caveat for that, you can watch my video for the details, but the caveat for that is it has to be the larger or giant breeds, those dogs, you want to kind of wait until, their joints have developed and their bones and everything have developed. So you want to look at maybe a year and a half or 2 years old before you spay them. But that's the caveat to the early spaying situation. So basically, I hope that helps you in terms of if you see a mass growing on your pet and you're kind of concerned as to what to do about it. And remember, guys, like any pet owner, because that's my objective here on this channel, is to empower you with information so that you can make health decisions for your pet in a responsible way, and you can be an active participant in your pet's well-being when you're interacting with your doctor. Because a lot of times the veterinarian is strapped for time, they have a lot of patients, and it's not because they don't want to explain. Sometimes they're just time challenged. So this hopefully will help you to have that kind of informed decision. So if somebody's pressuring you to do surgery when you want to try to do more conservative, a fine needle aspirate approach, then by all means say, hey doc, can we do a fine needle aspirate? Can you tell me a little bit about how you do it? And then talk to your veterinarians, talk to them. They're humans just the same. Talk to your veterinarians, explain to them what your concerns, your worries are. If a veterinarian is brushing you off or trying to make you feel like that question is a dumb question, then you probably need to change your veterinarian. But in general, we are humans just the same, and we also have pets. So we understand the challenge. When, I did a mass removal on my dogs, it was a lipoma, but I did it when she did her dental cleaning. And so we had two anesthesia. It's a whole nother story. But I'm just saying that we experience these things as well. So we can empathize and sympathize when these things happen to our clients and to our beloved patients. So hopefully this video has helped you to be able to have that kind of health related conversation with your informed discussion with your veterinarian, and then the two of you can come together and make that decision, which is the betterment of your health, and get your pet on that healthy journey to lead a longer, healthier, happier life. Peace out.